Welcome to the American Republic. Today, we bring you a major analysis that has found a shocking trend among medications advertised on television. The exhaustive analysis of the $6 billion per year industry has found that at least 68% of top-selling drugs advertised in 2020 were listed as low added benefit, which means they were not effective. The study was conducted by researchers from Johns Hopkins University, and they found that the amount of money promoting prescription drugs rose from $1.3 billion in 1996 to more than $6 billion in 2016. They found that 92 of the 135 drugs in the study, nearly 70% of them were shown to have little health benefit to the consumer. Dr. Michael DeStefano, the lead author of the study, said, "The findings suggest that shifting promotional dollars to direct-to-consumer advertising potentially reflects a strategy to drive patient demand for drugs that clinicians would be less likely to prescribe." Sorry to interrupt, but before we continue, please support us by sharing and subscribing to our channel, The American Republic. Your support helps us continue to bring you important stories like this one. It is essential to be careful when telling your doctor about drugs you saw advertised on television because they're not always very effective. Dr. DeStefano suggested that when a consumer sees these advertisements on TV or social media, they should question if it's the best drug for them and have a conversation with their provider. The Johns Hopkins University study found that 92 of the 135 drugs had low added benefits. That's 68% of the drugs in the study. Some of the biggest buyers for pharmaceutical ads were the antibody GammaGuard liquid, Yervoy for melanoma, and the multiple sclerosis treatment Ocrevus, which spent a significant portion of their advertising money on TV ads. In this Johns Hopkins University study, the low added benefit status means that the drug in question did little to nothing to help the patient's overall health or longevity. Although the medications are not really that effective, their direct-to-consumer marketing is very effective. The study authors wrote, "Allocating a greater share of promotional spending to consumer advertising, versus promotions that target clinicians, may therefore reflect a strategy to drive patient demand for drugs that clinicians might be less likely to prescribe." The study also found that drugs with lower added clinical benefit may be more likely to have lower cost alternatives, be part of a step therapy regimen, or have an unfavorable formulary placement. It is important to remember that just because a drug is advertised on television doesn't necessarily mean it is the best option for you. You should always consult with your doctor and ask questions about the effectiveness of the medication. This study should also encourage us to take a closer look at how pharmaceutical companies allocate their promotional spending and question if they prioritize patient health or profits. Thank you for tuning in to the American Republic, and we'll see you next time.